welcome. My name is Gabor Toth. I'm interventional cardiologist in Austria, and we are here to discuss the highlights of PCR 2015 in the topic of interventional treatment of heart failure. Welcome, Ran Kornowski from Israel and Jozef Bartunek from Belgium.
Good morning.
So, Jozef, traditionally the treatment of chronic heart failure is rather a pharmaco field, but still over the last few years interventional cardiologists are taking over some of this field. What is the reasoning behind? Why do we need it?
Heart failure represents one of the most prominent challenges in modern public health. It's a progressive disease where the current standard of care is not able anymore to address the increasing prevalence of heart failure, creating the therapeutic gap in the current multidisciplinary management. Devices are here to expand the armamentarium of the current approaches and have potential to address multiple therapeutic targets, addressing adaptive mechanisms or the substrates leading to the heart failure.
So the intention is indeed to fill a gap in the therapy, but Ran, was it really that hot topic at PCR 2015?
Yes, there were multiple sessions on the field of heart failure management and especially device-based technologies and new technologies to handle the growing problem of heart failure. I can summarize the field that has been presented during PCR. There have been many presentations on new sensors and implantable monitoring system, both internally and externally, and this was meant to detect heart failure before a true deterioration of the clinical scenario. Second, some implantable devices to unload the congested heart, such as valve or devices implanted between the left and right atrium to diminish the pressure increase during heart failure. Some devices in order to deal with the problem of ventricular remodeling, both from the left side and on the right side. And I think there is still interest, and there have been some presentation on the issue of biologic treatments such as cell transplantation or genetic modification in order to improve the heart function. So yes, I think that there is still a growing interest in this field.
So the approaches are pointing on monitoring and pointing on treatment as well. Jozef, how do you see the future?
I think we are going to see more and more of these approaches. And there are technological advances combined with biological advances, and all these are merging into one multi-facet management of heart failure. On one hand, optimal medical care, on the other hand, modulation of the ischemic burden, modulation of the valvular disease. This together, coupled with what Ran highlighted with the new approaches, will give hope to our patients and community to come up with a very concise, holistic approach to the complex problem of heart failure.
Ran, what should be the focus of the future? Where should we mainly attend to?
First of all, I see in the future more communication between the interventional cardiology community and the heart failure community, as well as electrophysiology. So we'll have to work as heart failure teams. Second, I think that some of the promises and some of the new devices and the preliminary clinical data we have right now should be translated into larger prospective randomized clinical trials with hard endpoints, because in heart failure it's about symptoms, but it's about prognosis. So we have to improve the cardiac prognosis of this patient. So I think there will be growing interest in the field, more activity, more trial, more data, and hopefully better outcome for the patients.
So I'm sure in the future we'll have a lot of discussion about this topic, and it's a growing field. So thank you for sharing your opinion. Thank you very much.
Thank you very much.
Yes, sir.